Hello, everyone. This is Mark Anthony with AI Edge Promotions, where we promote the best of the best doctors in their niche with what they do. Today, we're going to be talking about a couple things. We're going to be talking about Medicare. Why is Medicare coming after doctors? Why is that? I mean, come on. If something's working, why cut the camel's legs when it's actually going to the people and healing them? But that's another story. Today, we're here with an awesome doctor, Dr. Eric Codner. He's out of Columbus. His website is Columbus Physical, is it medicincenter.com, correct?
I think it's ColumbusPhysMed.com. Yeah.
BizNet. Okay. I'm like,
PhysMed.
okay, awesome. And if you don't mind maybe spelling that for everybody, that'd be great.
Yeah, it's Columbus, PhysMed.com.
Awesome. Keep it simple. So today, guys, I'm excited because Dr. Codner is not just, we're just talking about this topic. We're also going to talk about a little bit about him, how he got into medicine, how he got into helping people, healing people. And he's been helping so many people that where he lives, people are just amazed that they're able to get off the pills and start to get healthy again. Welcome to the show, Doctor.
Thank you for having me, Mark. I appreciate it, man.
Of course. Yeah.
The main, I'd say the main way we get people well, and the main reason why people usually come in is because we offer stem cell rich allograft injections. And an allograft is simply a tissue transplant. The tissues are from ethically harvested umbilical cord tissue. So a woman goes and has a full term, healthy C-section birth. The lab can take that tissue from the umbilical cord and make a product that's injectable. So this is not surgery. This doesn't involve a scalpel. And this product is full of not just stem cells, but collagen fibers, growth factors, everything your body needs to heal, particularly the musculoskeletal system. And they come to us with bad knees, bad shoulders, bad backs, plantar fasciitis, you name it. If it has anything to do with muscles, tendons, ligaments, nerves, cartilage, this stuff, it's the only thing I know of that actually helps the body heal. So you're not talking about treating pain with a steroid or with some kind of dangerous pill or opioid. It actually corrects the problem. And I was actually our first patient. I was patient 0.
Okay.
I injured my neck badly surfing, Southern California. Thought I broke my neck, actually. Landed in about that much water, full speed, head first. Thankfully, I didn't break my neck, but I was just left with tons of pain going down both arms. Got back home, did an MRI. My neck was just wrecked, multiple ruptured discs. Nothing really worked. Our practice didn't work. Physical therapy didn't work. All our just basic injections didn't work. And so I found out about the allograft and actually got an opinion from a surgeon. He took one look at the MRI and said, no, you're going to have your neck fused. And I'm a chiropractor. That's like a bad joke. It's a chiropractor with a fused neck. And so, we have an integrated office. So we have a medical doctor and a nurse practitioner. So I studied this allograft. Long story short, we put it in the neck, and it took about a month for me to see changes because this isn't a pain shot. Like I said, it's there to heal you. So it took some time, but the first thing I noticed was the numbness and tingling in my hands cleared up. And in about 3 months, I was able to lift weights, do everything I was able to do. And I wasn't able to do any of that. I could barely get through the day seeing patients and just couldn't sleep at night, just miserable. And so fast forward, we've been doing the allograft since that was in 2015-ish. So we've been doing it since at least 2016 and just helped hundreds of patients avoid surgery, get off pain medications, and just get their life back playing pickleball, back on the golf course, back, chasing their grandkids, and not one side effect. And it's just amazing. And I wish everybody could get the allograft. And we have a lot of people who do. Unfortunately, they have to pay out of pocket for it. And I guess that kind of leads us to Medicare and their stance on allograft therapy.
I'm sure they love it, right?
Yeah,
Oh no, it's healing people. So I'm sure they're like, hey, let's make it happen. We're Medicare.
Yeah,
We care.
Well, most people don't know that drugs, and I'm not talking about illegal fentanyl coming over the border. I'm talking about prescription and over-the-counter drugs account for the 4th leading cause of death in the United States. I mean, just take that in for a second. 4th leading cause of death. Only thing that kills you more is, heart attack, stroke, and cancer, and then drugs. The supposed cure is killing more people than anything except for the top diseases. So yeah, you would think Medicare would love a product like the allograft. And these allografts have been around for dozens of years. They just really haven't been used because they can't be classified as a drug, as a pharmaceutical. They're literally tissues. And so what ended up happening is this product did make it onto the market, make it onto Medicare's approved schedule. Okay, hey, that's great, right? And so we started using it. They paid like clockwork. And after about 2.5 years, we stopped receiving payment. And then immediately after we inquired what's going on, because we never got one request of records, never got one phone call from Medicare, nothing. And then we get a letter requesting all the money back. And we're talking, that's over $1 million.
No way.
Yeah. And so, I'd sought legal counsel, as one does. And this particular law firm was in the middle of suing Medicare on behalf of one of the labs who creates these products, because they spent millions of dollars to get Medicare approval. You can't just,
Right.
not anybody can get approved by Medicare. So they spent all that time and money to do that, just to have Medicare basically pull the rug out from under them and all the doctors. And I know dozens of doctors this happened to. This isn't just us. This is hundreds of across the U.S. And one thing that they all report, I haven't talked to one of them, and I've talked to dozens of doctors in the same situation. Not one of them has experienced a side effect from the allograft. They get overwhelming success from it. And patients loved it. We still have patients to this day asking, every year they call us up in January, hey, does Medicare cover this again? I want to get another body part done. And we have to tell them no. And it's just kind of mind boggling that, if I wanted to give this person opioid drugs or an invasive surgery, no problem. Well, they'll shell out the money, and even if it's in the patient's, not in their best interest. And so I just wanted to let people, because people don't know this is going on. Doctors, particularly doctors who practice more natural approaches. Not that we never use medications. I mean, sometimes you have to, but we try to be natural because these medications have side effects. People don't want to be on them. I got poor patients coming in. They got literally a grocery bag full of pills, full of prescribed medications. Now, how is that not malpractice? I mean, there's no way any doctor can predict how 25, and I mean literally 25 different drugs are going to interact in that person's body. But yet, Medicare's not going and recouping on those doctors. It seems that if you give them a drug, you're fine. But if you have a new innovative solution to their problem, you get penalized. It's just kind of insane.
Has that always been like that with Medicare, or is that just something that maybe recently happened, maybe 15 years ago?
Yeah, no, they have a history. I mean, just insurance in general. I don't know, if we could just point the finger at Medicare by itself, but I know of doctors who, were helping people naturally with cancer, for instance, and no one was saying that, hey, I got a cure for cancer. That whole idea doesn't even exist. There is no cure. There is just getting your body as healthy as possible, so then it can fight the disease, whatever that may be.
Right.
Cancer or arthritis, whatever.
Right.
So these doctors don't tell people there's a cure, but that's kind of what they get accused of, so to speak. And it does seem to be a heavy bias towards natural treatments, whether it's IV therapies. I know some doctors using chelation therapy, for instance, pulls heavy metals out of the bloodstream. And that's a fact. It does. And that can impact other diseases. And some of these doctors have got shut down for doing that. Very low side effect, treatment. It actually saved my grandmother, saved her life when I was a teenager. It was one of my first experiences with a, kind of a natural medical approach as a medical doctor who was a former vascular surgeon, and he gave it all up. And I'm sure that was millions of dollars he was making back in the 80s and early 90s just to do chelation therapy, because he saw it work in a patient and followed. He just followed his, he did the right thing and was helping hundreds of patients. And I think there is a bias towards that. So
do you see things turning around, or is there not, you don't see much of a light at the end of the tunnel right now?
So not immediately, but I am hopeful now that RFK Jr. has been picked.
It's better food, at least.
Right. I mean, that's the approach we need. There's so many, why isn't diet covered by insurance? The one thing that would fix probably 75% of diseases. Why isn't that covered? Why do patients have to pay out of pocket for that? It just boggles the mind. And now I think Dr. Oz is actually going to be put over Medicare. Maybe we'll see some good stuff.
That'd be interesting.
That's what I heard. I don't know if that's the gospel yet or not, but it wouldn't surprise me. And I am hopeful. I just talked to an older doctor, and he's practices similar to the way we do, very natural approach. And he was thinking about retiring. He's like, I think I'm going to hang out for a few more years and see what's going to happen, because he's hopeful. He's hopeful that will actually be able to do things for the patient, not be persecuted for it. It's kind of crazy.
I would love to. I would love to be like a fly on the wall when they're at their board meetings, Medicare, and talking and to see what's going on in the brains of people. And are they even a doctor? Normally, it's not a doctor, and it's really hard for doctors. And I respect doctors immensely, but when they sign that NDA, you have to be careful what you say, and you're owned. You can't say how you feel, even if it's the truth, because then you're taking away your income for your family to take care of them.
It is, and I feel for the rank and file medical doctors. It's easy to criticize. I criticize the system. Doctor goes to school, works very hard, goes into debt many times, and then he finds himself in this situation where you pretty much have to do the drugs. And so, number one, that's all you've been taught. Number two, that's all you're going to get paid to do. And it's really hard to go out of that normal system. I just was on the phone earlier today with a medical doctor who is practicing naturally. And yeah, she basically had to go back to school after medical school to
Wow.
learn how to help people. And it's crazy that is set up that way. We should be learning, in chiropractic school, we get exposed to nutritional therapies and, of course, chiropractic care, and just the philosophy that, hey, the body can heal itself if you set the right conditions. Yeah, there's certainly things that only surgery can fix, and maybe a medication, some weird genetic, but I'm talking I'd say 90% of people's problems could and should be handled in a more natural manner without drugs or surgery. Particularly the earlier you get it, the better it's going to work. And that's why I encourage our patients, look, if your knee's giving you a problem, don't wait until it's bone on bone, until, maybe not even allograft will work, if there's just no cartilage left,
Right.
get it fixed early. And that's where we see these products just, it's mind blowing, the results we get. I had a patient with drop foot. That's where you get such a bad pinched nerve that you can't raise your foot off the ground. You can't tap your toe, so he's dragging his foot coming in. And he had tried chiropractic care. He had tried, medical steroid injections. He had tried decompression therapy. And before he left the building after the allograft injection, he had his use of his foot back. Now, and I don't promise anybody, hey, that's going to happen every time. But I've just seen it happen. And if it seems like it's just too far to be believed, it's all you're doing is just using the body's God-given healing mechanism in the patient's favor. It's not rocket science, really. You're just, we know how the body heals. It's just no one's doing anything about it. They're throwing chemicals at it instead of, like these tissues that actually work with the body to heal. And there are patients I don't accept for care. I mean, there are some that I just, you're just too far gone, and I hate that, especially when they find out about us. And some of them, if they'd have just came in 5 years earlier, or maybe even
Right. The beginning of it.
Yeah, right. So
what would you say with allograft? Like, what are some of the main things that you normally see in your clinic of people coming in for that?
Well, so knees, definitely. Knees are most popular, I guess, body part. People wanting to get back playing pickleball or playing golf, or, just walking and exercising. Women, they don't want that big scar on the front of their leg, little vanity at play there.
Mhm.
And I wouldn't want it either. But so knees are the most frequent. Shoulders, I love the most, because we've only had 2 shoulders ever that didn't get optimum outcome. And I let the patient judge that. It's not me saying, hey, this worked. It's the patient saying that. That's what I count. Not like surgeons that say, oh, the surgery was a success, even though the patient's still in the same amount of pain they were in when they came in for. To me, that's not success. I don't know about you, but even though the surgeon did everything right, the person's still in pain, and so we only count those where the patient agrees, hey, this really worked. And so only 2 shoulders out of dozens and dozens of shoulder, rotator cuff and arthritis and shoulder impingement. I love shoulders because they just respond so well. But the same for the spine and, the low back or neck area. We treat feet, wrists, elbows.
What's one of the hardest areas do you notice with allograft that you've noticed?
The hip, for sure, the hip. And we rarely accept hips these days just because it seems that by the time the patient gets here, there's just no cartilage left. The bone is starting to deform, and it's just not going to work. I mean, nothing's going to work at that point. They just need a hip replacement. And I hate that for them. But if we can catch it early, like a tear in the labrum or, just an early arthritis. But see, I don't think the hip bothers most patients then. So they just don't go, or pain comes and goes. So they just don't do anything about it. And then usually they get corticosteroid injections first, and that further accelerates the damage. The steroid actually thins the cartilage. It temporarily shuts off blood flow to the joint. And that's obviously not good for a joint. It's not getting oxygen and nutrients getting to it. That's just going to accelerate the damage. And, all for what? Short-term pain relief. It's all they're getting from that steroid. And so, that's what we tell patients. We're an alternative to these corticosteroids and surgery. And they love it. Patients love it.
Are there a lot of people around, like a lot of doctors that are doing what you're doing in your current area right now?
There are a few. When we started back in 2016, we were the only game in town as far as that goes. And I think I can count off the top of my head. I know 4 clinics that are doing regenerative medicine here in Columbus, Georgia. And that's, town of about 250,000. So it's not nothing, it's growing, and I'm happy to see it. I don't look at them as competition. Good Lord, there needs to be 100 of us just in Columbus to solve the problems that we see. And I am glad other doctors are doing this, other clinics, because it lends credence. You see it. You're not the weirdo anymore. This is cutting edge. This isn't weird. This is what Tiger Woods and sports athletes and movie stars, they've been getting this for decades.
Well, they actually use it. They don't really talk much about it, which is interesting. Like Mel Gibson, and his father, dude, his dad's still alive. Should have been dead.
Absolutely.
Rogan, remember they were talking about that, and he was like, yeah, he was going to die, and then they told me stem cells, but I couldn't do it in the United States, so I had to go to like Nicaragua or something like that. He went down there, saved his dad's life. His dad's like in his late 90s now.
Absolutely. Yep. Fixed his hip up and gave it
and
to
stem cells we haven't even tapped into. That's the kicker there.
And that's another thing with the FDA. At first, there was no real prohibition on using it for systemically, put it in an IV, for instance. Now there definitely is a prohibition here in the U.S. It does vary. There's a couple of states, I think Utah is one, where you can legally IV it. And some doctors still do it, but they run the risk of, having the man come down on them. And for what? If the patient wants it, it helps I've never seen a side effect with it. And I think Obama, didn't he pass the Compassionate Care Act? Where's that at? What about the Compassionate Care Act? So it's only compassionate if it's a drug. If it's a natural product, hey, that's...
Why don't we just say that stem cell's a drug?
Well,
it's a joke, but I mean...
Yeah, I'm sure some people are going for that.
All about the wording. I was talking to one doctor a while back when the whole epidemic was like really heavy with COVID. And he said he had to go underground. He was giving stem cell shots to people with COVID.
Wow.
And it was healing them right away. No, but
yeah, I bet it was.
He did it underground. And they were healed right away because it goes right to all the inflammation in the body.
Yeah. And that's a great point. These things are like a homing missile to inflammation. That's what those cells do. They're attracted to it. And patients are like, oh, I'm like, well, really, we just have to get it close. If we get it close, it's going to migrate. And I remember one study where they attached a radioisotope tracer so you could see it on X-ray. They attached it to the allograft and the stem cells, and you could literally watch it. They put it on the good side of the knee, and it migrated to the damaged side of the knee, and you could watch it in real time. And has intelligence, and that's some level of intelligence. And drugs don't do that. They're just like wrecking balls that go through the body and force change whether your body wants it or not. And hey, if the doctor's good and it works out in your favor, great. But over time, stuff goes wrong with pharmaceutical approaches, and it just tears the body down. Another thing we've started doing is nutritional IV therapy, and we actually do get that covered through insurance. So get it now, folks, while you still have the...
What does it literally help out with, would you say, just to everybody?
I mean, you have to look at how nutrient deficient the average American is. The diet is just full of processed food that is devoid of nutrients. We mentioned before that, many of our patients are on, 3, 4, 10 different medications. Each one of those medications requires nutrients pulled from your body because they don't come with vitamins built into them, these drugs.
Right.
They have to pull vitamins from you to work. That's the cost of these drugs. They don't work for free. They absolutely have an impact on the body. They do something, but that something comes at the cost of using nutrients. Their very treatment they're getting is just draining them more and more of nutrients. And then your body has to detoxify the drug and detoxify, your bad diet and stress and just everyday living. Give them an antioxidant infusion as well of glutathione is what it's called. And glutathione's made naturally by the liver and other cells of your body. And it just detoxifies the body. And so patients report back to us because they come in, they want to feel good. they got these problems. Obviously, we can't say, hey, this is going to cure X. I don't even believe in a cure. So I already explained that. But we're real careful to say, hey, look, what this is going to do is put back what's missing, allow your body to have a fighting chance at being healthy, being younger, at maybe getting over some of these, autoimmune problems or just chronic inflammation that they're going through. So we're just putting back what's missing and giving them the antioxidants to clean up all the crud toxins that are floating around in their cells. And the first couple of visits, they kind of may actually feel a little worse, a little run down, a little like they're coming down with a cold or flu, because that's all the junk leaving. They're running for the doors. All the junk's leaving their body rapidly. So you don't feel good when that happens, So, but in 2 or 3 visits, now they start feeling that benefit, that energy, and sleeping better and more relaxed. Their blood pressure improves many times. And it's just a great way to help patients, and patients love it, man. That's like our number one most popular thing we're doing. Well, the newer thing we're doing. And, and it just fits well with allograft, because someone who's healthy, that allograft is going to work better. And someone who's healthy versus someone who is nutrient deficient and overweight and diabetic and smoking and all this. So, we're just trying to find new and innovative ways to get people healthy without side effects.
How long do they need do they come in like every couple months how does that work?
Yeah, once a week to every 2 weeks. Some people are driving a good distance to us, so maybe a little less for them, but it kind of depends on what they're going through. And, some people will come to us with a lot of health problems. They're going to need more than someone who, is, feeling a little run down, or maybe they have allergies, maybe they have, inflammation they're trying to get over. So, visits, and then we kind of reassess and see what else they need. And meanwhile, we're also talking to them about diet. We're talking to them about supplementation at home. We're talking to them about, natural ways to just walking around the block, even just some kind of exercise. And so we're trying to put the basics back in, but do it in a way that insurance covers, that and of course, it's not going to cause them more problems in the future.
Well, that's awesome. So basically what I'm hearing you say is you guys don't just focus on one thing, you're focusing on the whole body.
That's exactly right. People know us, and we at first did focus more on joints, and then we started to realize, hey, a lot of these patients, the reason why their joints are so bad is because they're overweight, they're inflamed, they don't eat right, they don't sleep at night because of XYZ. So you really have to address all that. You have to address all that, and to get the patient well.
I love it, man. I love what you do. It's interesting. People just think, okay, that person's a chiropractor, and it stops there. I mean, how many years of school did you have to go to?
Oh, was it 7? Gosh, it's been so long ago now.
And then a medical doctor, what is it like? Medical doctor, probably like 8 years.
It's 3.5 years of chiropractic school, but that's at 30 credit hour per semester. So it's within 75% of medical school. We take gross dissection, 1.5 years. It's really the first 2 years is pretty identical to medical. And then when they start learning drugs and surgery, we start learning adjustments and nutrition and wellness. And so that's kind of the difference there. So we don't obviously prescribe drugs, chiropractors don't.
Right.
Hey, I have medical staff, and I can't remember the last time we prescribed it. We don't need to. We get people well without drugs.
And the funny thing is you said something is our bodies were created to heal themselves.
Absolutely.
And not just that, I don't know if it was Socrates or somebody, but they said something about healing is in the hands, which is true. I mean, there's so much. I mean, if you have good energy, not trying to get all, new agey, but it's just, if you have good energy, if you're an excited person and you're massaging them or help, whatever, I mean, they don't realize that you're transferring that energy. And if you're like a serial killer, I'm in pain, literally,
Absolutely. And there is a ton of, energy-based healing therapies now. Chiropractic, I guess, was the original one, because you're literally laying on of hands, just like in the Bible.
Literally.
And but now there's we use red light therapy, we use pulsed electrical magnetic field therapy, PEMF, and all that's energy based, and it works. I mean, and there's research on it. And then most people like, oh, that's just voodoo, that doesn't really work. There's research article. I mean, I was shocked. I injured my ankle about a month ago now, actually broke it and ruptured 2 ligaments in there.
Wow.
And the first thing I did was the PEMF, and I just would do it for a couple hours every night. I mean, I was up walking in a week. I still use crutches around the office just so I could move
Right.
quickly. But the next week, no crutches. And all I did was the PEMF. I still haven't even done the allograft in it. We've been so busy. I have to make my own appointment.
Make
Uh,
your own time.
yeah, I have to make my own appointment these days, which is a good problem. Good problem to have. We're busy. And but yeah, just that one therapy. It lessened the swelling, and it's just a powerful magnetic field that you create around the damaged area, and it accelerates healing. It moves waste out of the area, pushes nutrients in, and just gets you well. And it's been shown to improve bone density and heal ligaments. This difference for me. I'd never really had to use it before. I've never since I've just had patients do the
Right.
therapy. Uh, I was like, hey man, this stuff works. That was great. It was
I feel like you guys are like Batman. Remember in the everything was Batman with Michael
yeah,
Keaton. Where does he get all these wonderful toys?
yeah, we got a lot of toys here.
It's funny. Whenever I go to a conference, I'm always buying a toy, dude. Like I call it a toy. I mean, I have a
Yeah,
couple beamers, for the blood flow. And
yeah,
let me tell you something, that sucker.
yeah, yeah,
I,
absolutely.
I mean, heals the entire body. I even bought one of those brain mapping systems for my head, because sometimes your brain's moving too fast to get,
Yeah,
slow it down so you can think straight.
so you can rest. Physiological rest, not just taking a nap, but just your brain has to go in that that different waveform so it can heal. And some people are spending 24/7 out of that waveform into hyper stress waveform, and they just can't shut down. They just can't shut down, and that's a good point.
No, I love it. Yeah, we can go on and on and on. But again, I just want to thank you so much, Dr. Codner, for being here on the show. And if you wouldn't mind just giving a shout out to where people can find you, your address, also the radius of the areas that you're helping people in, so that if there's anybody out there that wants to know, we can help.
Yeah, absolutely. It's Columbus Physical Medicine Center in Columbus, Georgia. We take care of people all the way from Alabama, gosh, from Auburn,
Wow.
and Auburn, Opelika area, all the way down to Albany, Georgia, Americus area. Far north is LaGrange, Georgia. And yeah, I mean, especially if you're looking for something that your average doctor want or doesn't offer, doesn't know about, we may have the solution for you.
Wow, thank you so much. I love your passion for wanting to help people. I like we were just talking about, there's a lot of doctors that come in with a good heart. They want to help people, they want to heal people, and then as soon as they sign that piece of paper, they're stuck and they're like, "What did I do?" I know it's hard for them to sleep at night. I just know it. I bet they're after a while the money's not worth it. But what I love about you is that you're basically an independent company. You're focusing on helping people in your area, and you don't really have too much strings attached to where you can't.
Right. Absolutely.
So keep doing what you're doing. And again, guys, make sure you guys reach out to Dr. Codner. I love what he does. And you don't have to live in pain, everyone. You need to realize that, pain is sometimes just a moment. You don't have to continue to be taking all these pills and pills and pills and pills. And then what happens when those pills wear off? You're going to get another pill that's going to be a high dosage. And guess what? That's going to wear off. Then you got to go to higher and higher. And guess what? That's not the way to live. Guys, make sure you guys see Dr. Codner. Check out the graft tissue, because that really works. I have a lot of friends that have done that. And let me tell you something. They sing the praises of that doctor. And the reason why this doctor doesn't have a problem with filling his clinic, it's because he helps one person, and that one person tells about 10 to 15 people, and it just continues to go viral like a stem cell. Anyways, thank you so much for being here, Doc. I appreciate you. You're a blessing, and blessings upon your business, and keep doing what you're doing.
Yeah, thank you for having me, Mark.
Of course. All right. We did that. That was fun right